you, so now.
No, you see, I would have made it if you had taken me there as your special aid. You see, when you're moving, I'm on the move. You see?
You would
Yes.
have you would have ill advised me to be firing people left, right, center too much.
I even think that you are wasting time. I have a long list of people that you need to.
Anyway, on the lighter note.
Yes, but nice to speak to you this morning because
Nice to see you too.
you've been on the move on many issues. Part of them is looking at the major hospitals. Yesterday, you attracted a lot of attention alongside your colleague in government, Alassane Suhini. We are TAMALE Teaching Hospital. What was the problem there?
Oh, so now, typical of me, you know how I operate, and as part of my usual working visit, I paid a surprise visit to Family Teaching Hospital very early in the morning yesterday. Usually, I would want to have first-hand information, one, and two, whatever I see at the health facility should not be because the minister is coming there and so they put things in order. It should be something that the people in the catchment area are familiar with, they enjoy and all that. And so I went to the facility to familiarize myself with the facilities there and the people there. So although it was a surprise visit, but I think the reception was warm. The CEO and his team came down to receive me. They conducted me around and they showed me the various directorates and departments, units that are more functioning. Some of them have been completely out of order for years, 5 years, others 6 years, in fact, some of them 7 years. And there was an issue of a patient, Salim, who lost his life on last Sunday. And so I had picked a lot of information on that particular issue. So when I got there, I also wanted to have first-hand information on that particular incident. And so that got me to engage some of the health professionals at the facility. And then after that, I had closed-door meetings with them to discuss some of the issues further and try to find immediate solutions to some of the issues. We had the short-term measures, the medium-term, and the long-term. So at the end of the day, it was a very, very successful trip.
So the engagement is what got, because it seemed for a moment...
That was the sensational aspect.
It got
and
heated.
I know that is what Fena is very interested in.
Yes. No.
So,
yes,
so
of course, I'm
happened.
a media man.
Yes, I know.
Yes.
This is what happened. A lot happened behind the scenes. And if you play some of my videos and tapes, Fena, I am the first person to acknowledge that our health professionals in this country are sacrificing a lot for this country. Some of them are working under circumstances and conditions that are not the best. I am the first person to admit that. But I think that there are also, a few ones that sometimes, in some cases, they also go overboard. In this instance, when I got to the facility, I had the opportunity to engage them at the ICU. I listened to their side of the story on the matter. Now, at that point, I had to limit the media, and so we didn't allow the media to even cover that conversation. But what really happened was that after the conversation at the ICU, they themselves told me that, Mr. Minister, we need to go to the red zone, the emergency session, so that we can explain to you what really happened. So when we got there, we met a gentleman, a medical doctor, who started taking us through what really happened. And I was composed. I was exceedingly silent, and I was listening to him in silence. After his submission, then I started following up with very few questions. And then, in the course of following up with the questions, the medical doctor made a statement. And I thought the statement was not for public consumption, one, and it was a very wrong statement. What he said was that he didn't understand why this issue has been blown out of proportion. Sima, if you lose a life, every life matters. It's a big deal. So if the medical doctor will stand in front of his sector minister and tell the sector minister that he doesn't understand why this issue has been blown out of proportion, it's a big deal. Especially when the township have heard that the minister is at the facility and they were there in their numbers. Especially when the relatives of the disease were also there in their numbers. To listen to a medical doctor say that he doesn't understand why this issue has been blown out of proportion. And so I had to tell him to keep quiet and then stop whatever he was saying. And so we were even moving off. And I think there was a few exchanges between him and my colleague, Suhini. So I was even trying to calm the situation down. But they could see that the doctor was still insisting. And I got alarmed. I said, wait a minute. If you can do this in presence of me, then I can imagine when you are with a patient. So it means that there was something wrong. And so I think this is what is going viral everywhere. But the situation is under control. After that, I spoke to them, and the things that government is supposed to do, we are taking immediate steps to, resolve them. So now, our health sector has deeply deteriorated. I must be very honest with you. And so going forward, we'll try our best. We're going to do some reforms in the sector. We'll have an emergency meeting, probably next week to meet all of them. We'll all judge, we think through it. One person cannot do it all. And so we'll try to bring out, because, and I have said it on various platforms, I do not understand why government will buy hospital equipment for, let's say, Kolebu, and they will run these equipment for fees. And then when the equipment is out of order, is broken down, then Kolebu will still be waiting for government to come and fix it or to come and replace it. I don't understand. Maybe one day I will understand, but I don't understand. So I think that we must have a policy direction where these revenues will be protected to maintain and to replace such equipment. I also think that we must have a policy where any internally generated funds in any of these health facilities, some proportion, some reasonable proportion, will also be pumped back into the hospital to maintain the hospital or even to expand the hospital. We have to all think through it and then, try to improve upon our healthcare delivery in this country.
I see. But in the meantime, going back to Tamale, the news that came out immediately after our visit is that the man who has the place has been removed. Is that accurate?
Yeah, that's accurate.
Why?
Sana, the president hires and fires. That is what I can say for now, with all due respect.
That the president hires and fires?
Yes, sir.
So this is a decision of the president, or your decision after going there? Or your recommendation to the president after being there yourself?
Sana, the president hires and fires.
And I'm asking whether he did that on your recommendation after seeing what happened there.
Sana, the president hires and fires.
Because the minority is accusing you of acting in an authoritarian manner. Stated that the appointing authority owes, by saying that, because they say you said that you owe no explanation, and they find that common authoritarian.
No, I didn't say that. I said the appointing authority.
Yes, owes nobody any explanation. That's what you said. And they feel that that kind of comment is authoritarian in nature.
Well, I think it's obvious, or am I wrong? Because in any case, with all humility and with all respect, when the president was appointing me, he didn't come to tell Ghanaians why he was appointing me. Tomorrow, when the president is firing me, I don't think it hasn't been the practice of this country. When the president fires, the president doesn't come out to say that A, B, C, D, when even the reason is obvious. The president is usually very, 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 very silent on the reasons why he removes people in this country. That has been the practice. And that is the point I was stating. If it came across as very authoritative, so that you know that is not my posture. You know, I'm a very, very humble person. And I will never, 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 put up such a poster. And so if it came across as that, I think I was just stating the practice, the convention in this country.
And I guess perhaps this might not be, because they are suggesting that you were the one, because there's a quote that's attributed to the minority where they said the law does not grant the health minister unilateral powers to dismiss a teaching hospital CEO, especially in the manner and under the circumstances in question. So you're saying that you were not the one who dismissed the CEO?
Sir, the president hires and fires. Are you very sure that, will you contemplate even a minute that I, KWABENA Mintah Akandor, can usurp the powers of the president? Are you sure that can happen? Huh? Sir? So my comment was just stating the convention, the practice, what has gone on in this, and this is not the first time. We are hearing this. When the minority were in power, they used to say this a lot. I have been in this space for some time now, and I'm not that boisterous personal. I don't put up that particular posture. So please, it's not me. It's not me.
I see.
It's not me.
Very interesting, because the issue, and I was often thinking that you went to Reach, we were not impressed with Reach. In fact, I have been to Reach, the Reach when it was constructed and where the state it is in now. Nothing happened to the man who is in charge there. But the Tamale Teaching Hospital man is fired by the president. So I was thinking that, but why is it that you're unhappy with Reach?
Don't get it. Don't confuse the two.
Okay.
Don't confuse the two. The Reach Hospital man is not a CEO.
Okay.
He is a medical director.
Okay.
Of Greater Accra Regional Hospital under the Ghana Health Service.
Okay.
And the Tamale man is a CEO of Tamale Teaching Hospital.
Okay.
Directly under the ministry.
Okay.
Not under the Ghana Health Service.
Okay.
I hope you've established the distinction.
Okay. Well, but let me conclude then by asking you, because you said the state of our health sector is deteriorating, and there's a need to deal with that deterioration immediately. Now, the deterioration, what form is it in? Is it infrastructure? Is it personnel? Where's the problem?
I think to a large extent, we have a problem about the maintenance of our equipment and even the maintenance of the infrastructure in general. So we must have a conversation around that. Because you go to a facility and the state buys a very expensive medical equipment, and for the past 6-7 years, the equipment is down, it's not been maintained, and it's not been replaced. I want to tell you a very interesting story. And listen carefully. I believe that after this story, we may have to end the conversation here. So now, there's a facility in this country where government bought all the equipment there. Then the facility decided to enter into a contract or into an arrangement with a private person for them to run the facilities. These facilities were bought by government, and in the sharing of the profit or profit sharing arrangement, the individual or the private person gets 80%, and the facility gets 20%. They are, and then that is not all. Some of the equipment developed force, and those equipment have been abandoned for the past 3 years. Meanwhile, about 80% of the revenue goes to the private person. And so when you come and you want to talk about some of these things, I think that you have challenges. You have challenges. I can admit and I can agree with you that I'll have challenges because that has been the system for some time now. And if you come and you disagree and you think that you want all of us to think through it and probably change it, you have some challenges. So, but I believe that there are a number of people who agree with me, especially some of the health professionals, and we are all determined to improve upon the system as we have come to meet it.
I see. Thank you. Thank you very much for speaking to us. And thank you for that education on the bit about the Ghana Health Service and the ministry matter. Thank you. That's Honorable Mintah Akandor, is Minister of Health, joining us on the line, explaining to us the Tamale situation, exactly what happened. He says the president hires and fires. He actually has been said to be the one who fired the CEO of the Tamale Teaching Hospital. He said no. The president hires and fires. So that is the responsibility of the president. And the only thing he said was that the president does not owe anybody an explanation as to why he's decided to keep one person in the police or remove that person. That is typical. That is